The impact of COVID-19 on oncology services in the UK has been really massive. Certainly when the UK lockdown was implemented, then we had a dramatic reduction in numbers of patients attending the hospital for routine appointments. We subsequently saw a dramatic reduction of the number of patients being referred, cancer patients being referred by their GPs with suspected cancer. And I think that the national data suggests that referrals dropped by about 80% in the immediate lockdown period. It's taken a huge reorganization of health services and the hospital. In oncology, we were very worried that patients receiving chemotherapy and therefore being immunosuppressed would be at high risk of complications of COVID-19 infection. And so the many centers reduced the amount of chemotherapy which has been given, and that's starting to recover now. Now we enter post-COVID era. I think that most of us feel that the COVID-19 infection is probably going to be with us for many months in the future. And that rather than returning back to normal practice, we're going to see a redesign of the way that oncology services, both with chemotherapy and radiation, are organized. Interestingly, in The Lancet about 10 days ago, there was a publication suggesting that our concerns, which were right about chemotherapy patients and COVID, actually seem to be largely slightly overestimated from our part, and that patients across the UK who've received chemotherapy during the COVID-19 peak of the pandemic in the UK do seem to have managed to get through that chemotherapy safely without the extreme complications which we had been concerned about. So I hope, and certainly we're seeing in the UK, that oncology practice is starting to recover, but the delivery of services will be slow to recover. And we've tried to concentrate the message to, especially to existing cancer patients, that they should be priority, and that following up of existing cancer patients and the presentation of potentially new cancers needs to be given a priority so we can carry on treating those patients despite the other changes happening.